light on this. Okay, there are so many things that we know about autism. Autism డే మనం సెలబ్రేట్ చేస్తాము. ఆ తర్వాత ఇంటర్నేషనల్ డే ఆఫ్ పర్సన్స్ విత్ డిజబిలిటీస్ 1992 నుంచి మనం సెలబ్రేట్ చేసుకుంటూ వస్తూ ఉన్నాము. ఆ తర్వాత ఆటిజం అవేర్నెస్ డే, autism pride day, autism acceptance day. See, these are all very inclusive, like we have a responsibility to have awareness and also to participate in all these things. చూడండి, ఇది ప్రతి చోట ఒక పండుగలాగా జరిపించబడతా ఉంటుంది. ఈ ఆటిజం అన్నది 12 నెలల ముందు, 24 నెలల ముందు చేయొచ్చు. లైక్ 24 నెలల ముందు కూడా డిటెక్ట్ చేయొచ్చు. కానీ అమెరికా లాంటి దేశాలు 5 సంవత్సరాల వరకు కూడా డిటెక్ట్ చేస్తూ ఉన్నారు. అయితే దీంట్లో ఉన్న ఇది ఏంటంటే, ఎక్కడైతే ఉంటారో అక్కడ వాతావరణం ఉంటుంది. ప్రతి చోట ప్రపంచం అంతటా దీన్ని పండుగలాగా జరిపించుకుంటూ ఉంటారు, గిఫ్ట్స్ ఇస్తారు. దే క్రియేట్ అవేర్నెస్ ప్రోగ్రామ్స్. ఇది ఒక మంచి డిపార్ట్మెంట్ ఆఫ్ ఎడ్యుకేషన్ నుంచి ఈరోజు మేము చేస్తూ ఉన్నాము. మీరందరూ దీంట్లో పాల్గొందుతూ ఉన్నారు. ఐ వన్స్ అగైన్ వెల్కమ్ ది స్టూడెంట్స్ who are participating online in this webinar. I welcome you all and the faculty members and also the other resource persons and research scholars, etc., etc. So, in this spectrum, what does this spectrum means? This spectrum, to describe about the spectrum, we have invited the doctor. ఇంద్రధనస్సులో కనిపించే రంగుల యొక్క బ్యాండ్ అన్నమాట. మనకు తెలుసు కదా. కానీ ఇంటర్నెట్లో ఎవరైనా ఒకళ్ళు యొక్క బొమ్మని, యొక్క ఇమేజ్ని చూసినడలా ఇది రంగులు ఈ విధంగా సర్కిల్లో ఉంటుంది. అది ఇట్ ఈస్ రిఫ్లెక్టింగ్, ఇట్ రిఫ్లెక్టింగ్. వాట్ డస్ ఇట్ మీన్? So I hope sir will throw very good light on this, and he will also talk about very much at length and breadth of this concept, evidence-based concepts and facts, autism spectrum disorder. So with these few words, I thank faculty members for giving me this opportunity to introduce the theme. Thank you, and thank you one and all.
Thank you, Sunandaji. Autism spectrum disorder is nothing but it is a developmental disability that often present with challenges before the age of 3 and last throughout a person's lifetime. Early identification, treatment, and support matters. Many important outcomes for children's lives are significantly improved with early diagnosis and treatment. Autism spectrum disorder is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. All true autism can be diagnosed at any age. It is described as a developmental disorder because symptoms generally appear in the first 2 years of life. People with ASD may also have different ways of learning, moving, or paying attention. So, before deliver the lecture, we'll introduce today's resource person, Dr. A. Jagdish Garu, to all the distinguished guests. I request to K. Umadevi to introduce today's resource person. Please come.
It is our great pleasure to welcome Dr. A. Jagdish Garu, our esteemed chief guest for today's webinar. Dr. Jagdish is the head of the department and senior consultant neonatal and pediatric intervention and early interventionist specializing in neurodevelopmental disabilities at the Developmental Health Clinic, Apollo Hospitals. He is also senior consultant at the Apollo Institute of Medical Sciences and Research, located at Apollo Health City, Hyderabad. Dr. Jagdish is actively involved in serving and coordinating the National Health Mission, a project under the government of Telangana. He holds certificates as a master trainer in autism tools from Pediatric Neurology, All India Institute of Medical Sciences, New Delhi, and as a master trainer in early intervention for neurodevelopmental disabilities. His areas of expertise include neurodevelopmental assessment, planning, and early intervention, particularly for children at risk due to intrauterine growth retardation in the age of 0 to 3 group. Dr. Jagdish primary areas of interest are the first 1,000 days of early intervention for neurodevelopmental disabilities, neuromuscular disorders, and their early therapeutic interventions. He has presented papers and posters at all several national and international conferences. Dr. Jagdish is an active member of the neurodevelopmental pediatric groups like Indian Academy of Pediatrics and Indian Academy of CP. He is an international faculty and speaker specializing in early intervention for neurodevelopmental disabilities. His areas of interest including early screening, diagnosis, and intervention for conditions such as ASD, ADHD, CP, SLD, and genetic. We are privileged to have a Dr. A. Jagdish Garu join us today, and we look forward to his valuable insights during the webinar. Thank you, one and all.
Thank you, Uma. Welcome, sir, Dr. A. Jagdish, sir. Thank you so much. You are here with us. Please deliver a lecture, a valuable time you are spending with us. Thank you, sir. Please.
Thank you, ma'am. Thank you so much. Shubhodayam. Good morning, one and all. Am I audible, madam?
Yeah, of course.
Thank you. It is my privilege to be here today at this assembly or senate of various professionals from Dr. Ambedkar Open University. I am very much thankful and grateful to the Vice Chancellor and the Dean and the program coordinators and the students for inviting me to disseminate the scientific concepts regarding this autism spectrum disorder. Thank you so much. If you have any doubts and clarifications after the session, definitely I will be giving time to interact with me. Are you able to see the screen, ma'am?
Yes, sir.
Yes, thank you. So before starting in detail about the neurodevelopmental disability, that is autism spectrum disorder, I would like to just brief about the first 1,000 days of opportunities for early detection and early intervention of the neurodevelopmental disabilities. Okay. So what do you mean by first 1,000 days? That is very important. And today's my session I'm dedicating to my professor, late Professor Dr. P. Sudarshan Reddy Garu, ex-superintendent of government Nilofar Hospital, and also head of the department of pediatrics, Apollo Institute of Medical Sciences and Research, who is my mentor, my teacher, and my spiritual guru and all. And before this, I just want to introduce a slide about the children, that is the voices of the children. So the children's perspective, if you look at, we are not the sources of the problems, we are the resources that are needed to solve the problems. We are not expenses, we are investments. We are the children of the world. Despite our different backgrounds, we share a common reality. We are united in our struggle to make the world a better place for all. So the smile that flickers on a baby's lips when he sleeps. Does anyone know where it was born, this is the interesting catch. If you look at the Dr. Rabindranath Tagore, the Crescent Moon novel, he clearly narrated about this. Yes, there is a rumor that a young pale beam of a crescent moon touches the edge of a vanishing autumn cloud. And there the smiles of the firstborn in the dream of a dew-washed morning. Such a beautiful narration Rabindranath Tagore explained about the first smile of a neonate or newborn baby. So the children respect those who respect them. So we need to respect our children irrespective of, the caste, creed, religion, disability, skills, skill deficits, strengths and weaknesses, everything. So we need to respect them. Then only we can expect respect from them. So a happy family is a healthy biological unit in the society. So the primary institution in any society is a family. So the family should be, harmonious. Then only you can expect the peaceful or peace in the nation. When there is a righteousness in the heart, there is a beauty in the character. When there is a beauty in the character, there is a harmony in the home. When there is a harmony in the home, there is an order in the society. When there is order in the society, there is a peace in the nation and the world. So this is, everything is interdynamic, interdependent, intercoordinated. So if you look at the definition of World Health Organizations, that is, health. The health is a physical, intellectual, psychological, emotional, and spiritual wellness. So the patients will be coming to the doctors when they become physiologically ill, but they won't come or visit or consultation when they are, weak in other areas like emotional competency, social competency, spiritual competency, and psychological. These are the very important domains which we need to address. But in developing countries like India or South Asian continent, the awareness is very less. So this is what the creating problems. So my personal experience is the children are not the patients are the parents. Because of lack of awareness, they could not able to approach, they could not able to identify the problems in their children at the particular age. So what is happening? There is a delay in the treatment, there is a delay in early detection, early intervention. So definitely every parent's dream is after marriage, their child should be the best in their health and also his intellectual functioning, and also he should be good in their academic performance, that is the studies, and he should behave properly, appropriately in the social behavior, that is the behavioral aspects, and also he should be fit enough, so sports, and also he should earn money more than the parents. These are the common expectations of every young parent. So you can call this child as a super child, definitely. But to get the super child, the mother should be a super mom, and also the father should be a super dad. So the parents should be the super parents. So are we really the parents of balance? That is a question mark again. So when we speak about the first 1,000 days, the first 1,000 days, including the 270 days of the pregnancy or gestational period, and also the first birthday of the child, that is 365 days, and the second birthday again, another 365 days. So totally it is coming aggregately first 1,000 days, which are very crucial in every human being lifespan. So if you look at the journey of the first 1,000 days, so every milestone has been, prefixed. That is kind of hardware, or you would call it as software. So God has been already, programmed. This is called programming of the growth and development of any child. At what age the child is supposed to, crawl, supposed to creep, supposed to stand, supposed to walk, supposed to ascend steps and descend steps. Everything has been programmed, including the developmental milestones like gross motor, fine motor, personal skills, social skills, adaptive skills, speech language, communication skills, sensory development. Everything is programmed. So the first 1,000 days now you are coming to learn that the first 1,000 days is during the first, the day one of conception till the second birthday of the child. Remember again, the day one of conception till the second birthday of the child. These are the days very, very crucial and very significant, and of course, very critical. So the first 1,000 days really matter in any child's development. So when you look at the Adi Garbha, that is the Garbha Samskar, education in the womb, that is nothing but the molding the mind and the personality of the unborn child. We call the prenate. Prenate is a child during the pregnancy or the gestational period. The modern science of the neurology has woken up to the secrets of 7,000 years old Garbha Upanishads. So already it is existing in our Indian ancient literature, the Garbha Upanishad. So Garbha Upanishad is nothing but the Garbha Samskar. We need to samskar both maternal women, I mean pregnant women, as well as the child in the mother's womb. Then only you can expect the healthy child in that family. So when it comes to a child's mental and behavioral development, when it starts exactly? After the birth, or after 1 year, or after 2 years, or after 5 years, or none of the above. So the answer is as soon as once women conceived, the mental and behavioral development starts. So that is what the importance of the conception. Day one itself. Do you think the mother knows? No, mother also does not know the time of the birth of the child. Only people knows that when the baby comes out of the womb, then that they will consider it as the time of birth. But we consider the time of birth from the day 1 minute of conception. Even this, the mother also does not know. It is a top secret of the nature. Okay. So the story of baby when really begins. So if you look at this, baby life story begins much more prior to the birth, not after birth, not after coming from the mother's womb. Prior, that means day 1 of conception itself. So when it comes to the planning of pregnancy, it should be by choice, but not by chance. So being relaxed can double the chances of becoming healthy pregnancy. So it is very important for a woman, adult woman, to be relaxed psychologically, emotionally, spiritually, so that there are a lot of probabilities to become a pregnancy. But nowadays, what is happening? The young couple are going to the IVF centers, that is in vitro fertilization, as well as OSD, that is ovulation stimulation drugs. So what happens with this? So there is a probability that is 5 to 8% of the increase in the twins as well as preterm babies if they go for IVF as well as OSD. So preterm babies definitely develop some kind of developmental delays, developmental problems or issues. So when it comes to the pregnancy, whether it is really internal pregnancy or external pregnancy, it is an interesting question, but it is both. The answer is both. How? So internal pregnancy is nothing but in the mother's womb, the baby is connected through the umbilical cord with the mother's body. And when it comes to external, that is nothing but the breastfeeding. In the form of breastfeeding, the baby is connected with the mother through the milk, through the breast. So here the pregnancy continues even after the birth. This is what very important, interesting aspect which you need to know. That is why we call the lactating mothers also a pregnant. Till the stoppage of the breastfeeding, she is a pregnant only. So it is very important to the family members to take care of the both maternal, the mother as well as the child. So breastfeeding is very important. So mother's milk is very important because it helps the baby to develop the growth and development very fast, because it's a kind of neuro exercise. And also mother's milk definitely consisting of nutrients, micronutrients and macronutrients, which are very important and essential for the growth and development of the baby. And also the breastfeeding should be a sacred time. But not is happening. The women are working and they are giving the breastfeeding, they are talking, they are giving the feeding to the babies. That is not the sacred, that is not the sacred time. That is not the breastfeeding. A breastfeeding means in a privacy environment, the mother and the child only should be there. So the baby should feel secure, and also maternal warmth feeling the baby should gain from the mother. Touch, that is very important. And also during the feeding, the mother should have positive thoughts in her mind. She should not have any kind of depressive thoughts, sad moments and all. Then only the milk, the body will generate the positive hormones in the mother's body. From the mother's body, it goes to the baby's brain through the milk. So that is why it is called a sacred time. So preconceptual guiding is very important, which is missing piece nowadays. So the young, people should have a pregnancy plan, and also health of the couple, that is both husband and wife. Sexual health of the couple, that is very important. And the nutrition of the woman also very important, whether the woman is facing iron folic acid deficiency or not, or any kind of zinc deficiency or cholecalciferol, vitamin D3 and magnesium, and all, hemoglobin. This all we need to check before pregnancy. And also avoidance of the substance abuse, like smoking and alcohol drinking and all. That is very important. And the prenatal stimulation is very important. The motivation of the mother that is towards to mental health. She should not face any kind of depression or sadness or distress or like that. And learning the techniques to how to stimulate the baby in the womb of the mother, that is very important. And creating a happy and healthy atmosphere at home by the family members, and preparing the whole family for baby arrival or welcoming, that is also very important. That's a positive welcoming. So a mother should have a positive attitude herself towards to giving the milk, because the breast milk is a complete package of micro and macro nutrients. And also, as I told you, this is a neuro exercise. So if you compare the baby who is breastfed, the baby will get the speech language communication development at earliest, and gross motor development, fine motor development, visual motor development, and also everything, intellectual development, that is cognition, that is IQ also. But the child who is on the bottle fed, that child's speech language communication and academic, that is IQ levels and social quotient, will be lesser compared with the baby who is on breastfed. So that is very important. Breastfeeding is nothing but a neuro exercise for infants. We need to encourage this. And the play is very important. During the pregnancy period, the baby inside of the mother's womb, that is nothing but amniotic fluid, the baby will swim. So some mothers definitely will be having lesser amniotic fluid in their womb. So the baby cannot swim. If there is no swimming in the amniotic fluid, the contractures will be developed. So it leads to the development of cerebral palsy, CP, or spastic child. So the mother should take care that enough quantity or amount of the, that is amniotic fluid during the pregnancy period. So she should take proper nutritious diet, and also without any psychological distress. Then only the play happens. Because play is very important. Because through play only the baby's growth and development happens. If the mother is happy during the pregnancy period, so the oxytocin hormones will be released in the mother's body, which helps the mother to develop the positive mood and also stress coping mechanisms and social well-being and trust and empathy. All these will be developed if the mother is, does not have any kind of psychological distress. Okay. So the fetal origin of adult diseases, if you look at a healthy nutrition, definitely normal weight, overnutrition, overweight or obeseness, and undernutrition leads to definitely underweight of the baby. So when it comes to the prenatal development itself, if you look at the Indian mythology or, like Bhakta Prahalada, Abhimanyu stories we might have heard. So the babies inside of the mother's womb only will learn everything, like sense of touch, pain sensation, taste, swallowing, hearing, listening, and also learning. Everything takes place. The only thing is the baby inside of the mother's womb, he just listens. The only septum is the mother's womb, but inside he will listen everything, what is happening surrounding. So how the husband is treating the woman, and how the grandparents, everything he listens. The baby listens. The baby feels the touch. Even the baby, feels this one also, I mean to say the psychological and emotional well-being of the mother also. So if you look at the human brain development, the early synaptogenesis, it's a word, early synaptogenesis, the concept. So the vision pathways and cognitive pathways and language pathways and also higher cognitive pathways will be developed during the pregnancy itself, not after the birth, not during the schooling, not during the community exposure. Everything he will learn during the pregnancy itself. That is why I say the primary institution for a child is Adi Garbha, that is mother's womb. Second institution for the child is mother's breast and the lap, because where the child will, take the milk and also relaxes and enjoys with the mother's maternal, touch. And the third institution for the child is the home environment. And the fourth institution for the child is the neighborhood environment. And finally, the fifth institution of the child is the play school or the nursery where the child will be enrolled in the school. So this transition has to go ahead in a proper way. So it has to be taken care by the parents. Earlier, the neurologist says that, oh, this child is like a father, this child is like a mother. No, now it got changed. The genes and chromosomes in our body are listening to the environment. So that is why this environment is called as epigenetics. So genetics means the baby's hormone.
Backlog Kalilu,
Genetics means the chromosomes and genes. Epigenetics means the environment. So the genes and the chromosomes are listening to the environment. So the baby should gain or to get proper prosthetic and also nurturing environment at home as well as in the community. That is very important. Okay. So there are so many, aspects here which I don't want to go in detail, but it is very important for the mother to talk with the child during the pregnancy period. So the child should be interacted by the mother should interact with the baby by talking. So during the pregnancy period itself, the mother should talk with the child. Please avoid the carrying mobile phones on the body because it affects the small dose of radiation will impact the child's brain growth development. So not to expose to electronic gadgets, the mother itself, maybe like phones, maybe laptop, maybe TV, or maybe, some other electronic gadgets, because it affects the baby's growth and development. And effect of maternal stress also is one of the important. Preterm deliveries and also low birth weight, very low birth weight, extreme low birth weight, and developmental delays. If the mother undergoes during the pregnancy period any kind of psychological, emotional distress, directly it affects the babies, which causes, very low birth weight and also risk, that is preterm high risk babies, and developmental delay of speech language communication, motor development, and cognitive development and sensory development. Okay. So when it comes to the figures, that is in India, nutritional value, it's 35% of the children are underweight and 50% of the children are anemic, almost 50 plus. It is really worrying aspect. So taking iodine during the pregnancy definitely boosts the baby's brain function, and not to take the paracetamol tablets unnecessarily, because paracetamol tablets increase the risk of attention deficit and hyperactivity disorder in autism. Okay. So without doctor consultation, not supposed to take. That is very important. And severe iodine deficiency definitely can reduce a child's IQ by almost 15 points. And iodized salt helps to nurture a child's mental development. It is very important here. Some children with autism spectrum disorder or attention deficit hyperactivity disorder, they will not sit at one place. They will be roaming there and here. They will be having hyperactivity, overactivity, physically overactive, distractive, violent, oppositional, and defiant, and impulsive sometimes. So why my child is not sitting at one place? Why my child is hyperactive, overactive? Why my child's IQ level is low? Why my child's developmental is delay? There are so many issues. But inside, when we take the blood test, what we will come to know that the cholesterol deficiency definitely, which causes irritability nature in the child, aggressive behavior in the child, and hyperactivity behavior in the child. And also zinc deficiency deal associated with inattention, that is attention and concentration span, which is very less. And magnesium deficiency causes the hyperactive behavior in the child. Iron deficiency causes the insomnia, sleeping sickness, and also low IQ levels and attention concentration problems. Hypothyroidism, definitely it causes the developmental delays and attention and concentration deficits. And it is very important for the pregnant woman to take care of the gums and teeth, that is a periodontal area, because there is a probability of preterm and low birth weight. So it is advisable for the pregnant woman to brush her teeth 2 times, that is morning and evening, because it causes the low birth weight babies and premature babies. Again, it causes the autism spectrum disorder, attention deficit hyperactivity disorder also, sometimes ADD. So if the pregnant woman undergoes psychological emotional distress, it causes the formation of the negative hormones in her body. So naturally what happens, the cortisol levels in her body will increase. So definitely it causes the premature delivery. So maternal stress during the pregnancy affects the motor skills of the child and also behavioral problems in the child. So it is our duty to take care of the pregnant women in all the aspects, psychologically, emotional reassurance, as well as, proper nutrition. Okay. And during the pregnancy, actually, spouse or family member to accompany during the child birth is very important. Because the woman, whenever she's first time delivering the baby, naturally she will be having a kind of anxiety and also a distress. If the husband or a family member, preferably the maternal mother, the grandmother of the child, okay, if she's there, accompany, the delivery process will be proper. And also there is a probability for normal delivery instead of LSCS, that is C-section. So the moment a child is born, the mother also born, which is very important. So we need to appreciate, because that is why second janma they say in our Indian tradition. It is true also. So there is a need here, powerful need. We have to concentrate on both mother as well as child in all domains, psychological, emotional, spiritual, and also physiological health of both. Intellectuals solve problems, genius will prevent the problems, as Einstein. So we need the children to be genius rather than intellectuals. So to get the genius children, the mother's health during the pregnancy period, we have to take care, and also after birth, both mother as well as the child should be taken care. Many things we need can wait, but the child cannot. Now it is a time, his bones are formed, his mind developed. To him, we cannot say tomorrow. That means we cannot postpone. His name is today, as Gabriela Mr. clearly stated. Even the National Early Childhood Care Education Policy clearly stating that from the birth day of conception till third year of the child, the baby is having rights for survival, safety, protective environment, healthcare, nutrition, including infant and young child feeding practices, attachment to an adult, opportunity for psychosocial stimulation. The child should undergo early intervention in a safe, nurturing, and stimulating environment within the home first, because the home is the first institution for any child. If you want your children to be intelligent, read them fairy tales. If you want them to be more intelligent, read them more fairy tales, as Albert Einstein quoted well. And this is a very important slide which I'm presenting here. Early childhood development is a smart investment. In most of the countries, what is happening? The governments are not focusing on young girls and young boys' health and also prenatal health. If you focus on an adolescent girl health as well as the adult health and prenatal health, you cannot get any kind of child with developmental disability in the society. So instead of human resource development, instead of disability welfare, instead of all the training programs, instead of investing so much of budget on the disabilities, better to invest the same amount on the preventive aspects. That is a level of primary level of prevention. Okay. So this Heckman's Nobel Prize winner, he clearly stated the prenatal programs plays a crucial role so that we won't get any child with developmental disability in the society. Okay. It is easier to build strong children than to repair broken man. So what you do, what you eat, what you experience during the first 1,000 days has lifelong consequences for the health of the child. So the human computer, if you look at, that is the brain, which is very complicated than a computer. Early wiring and early pruning happens. So early synaptogenesis, that is early sensory and motor pathways which are developing the child's brain during the early development, which we need to take care. That is why I always say the first 1,000 days really matter a lot. It is a singular window of golden opportunities for the child life. So we have to focus on the first 1,000 days because of the neuroplasticity, because it is a brain's potential to create or change networks of neurons based on experiences. So if the child gets good experience, positive exposure from the positive principal parenting or positive parenting from the parents, definitely the child will be perfect and normal and genius. So early experiences matters a lot. 90% of a child's brain development happens before the age of 5 years. So 5 years before only the child has to identify earliest with the developmental disability or difficulty or disorders, and also should intervene. That is, early intervention is very important. We cannot postpone this, because nowadays what is happening, practically the parents are getting their children at the age of 1 year, 1.5 years, 2 years, 2.5, 3.5. My child is not walking, my child is not speaking, my child is a delay in studies, academics, like that they're getting. But it is very important to create a public awareness programs, and this knowledge has to be disseminated for the primary level of prevention. So at the age of birth, if you look at the chart, 100 million neurons will be formed in the brain. 15% connections only will be made. 85% still yet to connect. So it's a golden period. If you look at the third year, 10,000 neuronal connections for each neuron will be formed, and 1,000 trillion connections will be formed. So you need to intervene the child from the birth to 3 years before, earliest, preferably in the case of neurodevelopmental disabilities, because 75% of the brain growth completed by 2 years and 90% of the brain growth completed by 5+, and myelination almost completed by 2 years. So we have to identify the child at earliest. And here the caregiving, responsive caregiving is different. Every parent is giving parenting, fine, giving food, giving clothes, giving shelter, and giving materials. This is simply called parenting. But the positive parenting, principal responsive caregiving, principal responsive parenting is different. We need to attach to the child. We need to pay attention to the child's needs when the child needs you. That is very important. Otherwise, what happens? The language and communication and emotional development and speech language development will be affected. The more you interact with your child physically, instead of electronic gadgets, instead of leaving the child in the creches and all other areas, ayahs and maids, it's very difficult. So the child's attachment with the parents during the first 3 years on. So parents should give time to the child during the early development. That is very important. Epigenetics, that is environmental things, what it is taking a long-term emotional inoculation. Everybody is taking vaccine nowadays, but what is the first vaccine for the child? That is colostrum milk. The first milk to the baby from the mother. And the next is emotional inoculation. The vaccine, it works like a vaccine to the child. The more you are available to the child, physically, mentally, psychologically, spiritually, that matters a lot for the child. You may not be knowing this, but it is very important truth that you have to spend time for the better future of the child. That is what the epigenetics are saying. Toxic stress definitely derails healthy child development. And it will have long-term negative effects on the learning, behavior, physical and mental health. What is toxic stress? The child who is under abuse, the child who is under verbal abuse, the child who is under physical abuse, and also the home environment which is under distressful condition, disharmonic condition, that is nothing but the toxic stress to the child. Definitely it will affect the child's learning, behavioral, physical and mental development. So positive stress hormone is very important. Positive stress response means good. If you are saying good to the child, if you pat the child, if you hug the child, that is positive stress response. If you just leave the child, that is tolerable. If you beat the child, he tolerates your punishment, but it's tolerable stress response, which is not good. Toxic stress response means you are not at all, totally ignoring the child, totally ignoring the child's needs, emotional, physical needs, and all needs. That is toxic stress response, very dangerous. So the children needs positive stress response from the caregivers, from the parents, from the teachers and all. Okay. So if you look at any parent, generally they focus on IQ of the child, that is intelligence quotient of the child. But the parents are supposed to focus on developmental quotient, DQ, emotional quotient, EQ, social quotient, SQ, spiritual quotient, SQ. These are very important competencies which are highly required in present children or generation. Because I have seen many children who are good at academics, they are poor in emotional quotient, emotional competency. Nowadays adults and girls and adults they are attempting suicides. Why? Because they are having low level of self-esteem, low level of self-confidence and all. So we need to inculcate all these competencies right from early childhood with the social and emotional learning, SEL programming, right from early childhood. Social and emotional learning is very, very important. Nowadays parents are exposing themselves to electronic gadgets, which are very dangerous. Because of the early exposure to gadget, the child may develop so many behavioral problems like autism spectrum disorder, poor memory, poor motivation, depression, anxiety disorder, cognitive problems, obsessive compulsive disorder, dissociation disorder. There's so many, list goes on. But mainly I'm telling, do not use TV, video games, smartphones, computers for engaging small children. Not even assisting during the feeding, especially for the first 3 years. But most of the parents, mothers, they are giving the phones to the children. They are showing the rhymes and video games and all. It affects the child. The child's brain becomes a digital brain. It is nothing but the child's brain becomes autistic brain. And also the child may develop ADHD, attention deficit hyperactive disorder. So effect of the screen exposure on the brain, if you look at so many MRI scans, clearly showing that how far it impacts the developing brain of the child. The red marks you can see in the both right and left cerebral hemispheres. So please do not expose child brain to the electronic gadgets, including TV also. The child needs physical interaction, human interaction, rather than electronic gadget exposure. So too much gadget use can damage your child. It can cause speech language communication developmental delay, attention deficit, learning problems, including the specific learning disabilities like dyslexia, dysgraphia, dyscalculia, dyspraxia and all, and insomnia, sleeping problems, childhood anxiety disorder, childhood depressive disorder. So please never expose the child to any kind of electronic gadgets. Okay. And I want the parent should be like Ansel, not as a, different like negative, because influences on the child definitely goes time. But many parents have seen, they just scold the child, they themselves frustrate in front of the child, and they throw temper tantrums in front of the child. Those are called ghosts in the nursery. So the angels are like this. Angels are the people, they love the child, they play with the child, they pat the child, they will be there all the time to the child. That is called angel. The ghost means the mother herself will be in depression, anxiety, busy, preoccupied works. She won't give time, and the father also won't give time. So how can you expect the growth and development in the child? You cannot. So mother after delivery, post definite depression will be there. That is a post-depressive cases I have seen. The child will be neglected, ignored, and left outside without any interacting with the child. So postpartum depression is common cases in developing countries. So while giving milk also, the mother herself will be in her own world of depression. So her mother's body will secrete the negative hormones. So those negative hormones through the milk, it goes to the child's brain. So the brain of the child will be adversely affected. So that is what I just always suggest you, please, when you are giving the milk, you have to give in a privacy with the positive, happy moods only. There is a research. In the research, what we came to that out of 5 children, 1 child have a parent with mental illness. Okay. So this is also one of the spectrum. Mood disorder can present in a spectrum. So the parental anxiety, parental depression, parental happiness also affect the child. So 10 to 20% of the postpartum women definitely experience anxiety disorder and depressive disorder. So the mother and the infant interactions are very susceptible to the disruption. So mother-infant interaction should be healthier, should be proper. But nowadays, what is happening to the children? Children feeling like they are lost, they are abandoned, they are neglected, they are rejected, deserted, and they are feeling alone, they are feeling like removed, they are forgotten, and forsaken, overwhelmed, so many, all the negative things. The present global children are suffering with these kind of negative thoughts. They are growing. 80% of the new parents, young parents, felt both anxious and completely unprepared with the practical skills which are required to look after their babies. This is the one of the survey, it is revealing this. It's a fact. So the decision to have a baby should be made mutually, that is between husband and wife. That is very important. Loving parenting skills are very important before giving the, birth to the child. A good education definitely begins at home. You cannot blame any institution for not nurturing values in your child that you have not instilled as a parent during the first 1,000 days. Then how can you expect from the institutions? You cannot. You don't have rights also. So you yourself as a first resource and source person to your baby. That is very important. And please be wary of Dr. Google, because nowadays everyone is approaching the Google for the search history, and people are developing cyberchondria, which is very important and dangerous mental disorder. It's nothing but a called idiot syndrome, internet-derived information, obstructing the medical treatment and worrying about its adverse and side effects. So approach the clinician or the doctor instead of Google, because most of the parents who are having children with autism spectrum disorder or ADHD, they are just searching the Google and they are developing emotional trauma and dilemmas, and they are just doing shopping of the therapies and the doctors. They themselves are in confusion. So it is a kind of state called cyberchondria. It's one of the serious mental disorder. So better to avoid this Dr. Google. It's like monkey see, monkey do, monkey fail. Just like how we are, same our children are like this. So in pediatrics, early refers means 0 to 3 years. So it's a golden opportunity for any child. So we have to catch these children at earliest so that intervention can be done at earliest. Okay. So be who you needed when you were younger. That is very important, because preventive medicine is very important than a curative medicine. So before delivery only, we need to take care of the mother. So as the Christian Bernard clearly stated, I have saved the lives of 150 people by heart transplant. If I had focused on preventive medicine earlier, I might have saved 150 million. So this is very important about the significance of the first 1,000 days. Okay.
Thank you, sir. Thank you
And
so much, sir. Really,
This is about the first 1,000 days I covered. Okay.
sir.
Now we will go to the next chapter, that is, autism spectrum disorder. I hope the time is 12:15, I think. Okay, we can just.
So really, it's a very useful information for us, sir, about ASD, early intervention.
Yes.
Thank you, sir. Thank you so much. Any audience?
Early intervention. No, this is the first 1,000 days importance I have given, madam. Yes.
Okay. Okay, sir.
If you allow the time, we will go to the autism
Sure.
in detail. So in United States of America, the latest statistics is out of 40 children, 1 child is identified with autism spectrum disorder. Even after COVID also, okay, even after COVID, many number of children with particularly male infants are identified or diagnosed with neurodevelopmental disabilities, that is autism. So autism means it is nothing but always unique child, totally intelligent child, but sometimes he behaves mysteriously. I think everyone is autistic as per this. Okay. So if you look at the strengths of the child with autism, they are good at reading skills, they are good at exceptional balance skills and drawing skills, computer skills, exceptional memory skills, and also music skills. These are the strengths of the child with autism spectrum disorder. If you look at the history, Albert Einstein, Isaac Newton, there are so many famous people who are having autism. Please do not use the word autistic. Say the child is having autism spectrum disorder. Okay. And if you look at the practical, the realities, the child with autism, who is scored almost 10 toppers in United Arab Emirates. This is one of the interesting aspect. Is a CBSE board class 10 topper, and is India's first male model with autism spectrum disorder. Okay, and another child who scores 89% in the CBSE examination, who is also identified with autism spectrum disorder. So worldwide, globally, almost 1 to 2% of the children identified with ASD. So here, almost if you look at in India, nearly 30 million people in India are suffering from ASD. But the problem here is the parents of young children with autism go into denial. They are refusing to believe the diagnosis. They are not accepting that their child is having ASD. So it is happening, leading to developmental delay. Therapy also delay is happening. And also finally, it is failing to the mainstream education, that is into education, it's affecting. So common doubts among the parents, how to choose therapist for their child with autism, which therapy is suitable, what is the therapy, what this therapy really involves, and what is the importance of the therapy, why this therapy may be effective for your child, which therapy is safe, is the therapy effective, is it having a scientific evidence, and who is the right doctor, right professional, how to select the professional. These are all commonest doubts among the parents with autism spectrum disorder. If you look at the autism, actually, the auto means self, isolated self. The child who neglected during the early childhood development, the child who is, not with the parents, the child who is with the electronic gadgets during early years, that child will develop the ASD. And also refrigerator mother's theory was there earlier in 1967. The parents who are not loving their child enough also causes autism. It is true also. So another aspect is MMR vaccine. Most of the parents, they say that up to 1.5 years, my child was nice and normal. His development was normal. But after, 1.5 years, his development declined or regressed. After vaccination only, they say. No, it is not because of the vaccination. MMR vaccine does not cause autism spectrum disorder. That is very important. Okay. And when you look at the child with autism, the clearness is there. Extreme aloneness during early life causes autism. The parents, both parents, if they work, the child will not receive proper touch, proper maternal touch or, love and care, which causes autism. The child who exposed to toys, mobile phones, screen time, and the child who is excessively aloof or lonely with less human interaction, that also causes autism spectrum disorder. So now it became one of the epidemics, So the child with autism spectrum disorder will be having other problems also, like gastrointestinal problem. The child will not, digest as well as swallow the food. Oropharyngeal musculature will be weak. Oromotor problems will be there. He cannot chew, he cannot masticate, he cannot swallow sometimes. And the child will be having sleep disturbances, insomnia, sleeping sickness. The child will be hyperactive, overactive, distractive. He will not sit at one place. The child will be having motor problems and also visual motor problems, language disorders, speech language communication, developmental delay, and child may be having intellectual disability. The child may be doing repeated movements. The child may be having obsessive compulsive disorder and also social anxiety. And also he will be having less immunity system. Frequently he suffer with physiological illness or the diseases or disorders. And also the child may have epilepsy or fits also. So it is not compulsory that all children with autism spectrum disorder should have all these. No, the child may be having 2 or more. The child may be having 1 also sometimes. So these are the core symptoms in autism spectrum disorder. So how to identify the child with autism at earliest? So the child will be not having no smiling by the 6 months, no babbling and no pointing, and also are meaningful gestures by 1 year, and no 2-word phrases by 24 months, that is 2 years, and no 1-word communication by 16 months. These are the clear indicators. For example, when the child is in the mother's lap, if the mother smiles at the child's face, the child should laugh at the mother's smile. If the child is not smiling at mother's face, if he is looking there and here, so there is no eye contact, that itself is an indication for the child who is developing autism spectrum disorder. So these are some commonest behaviors which you can see in the child with ASD. Inability to relate to other children. The child will be aloof. He will not interact with the peers. He will be having poor speech or lack of speech, and he will be having hyper or hyposensitivity, that is sensory processing disorder or sensory problem. It may be auditory, it may be visual, it may be a touch or tactile, it may be gustatory or olfactory. And inappropriate playing, if you give the car toy, he will play with the wheels of the car, not with the toy, not with the car at all. And he will be having attachment to the particular color, particular person, particular place, particular sound, particular touch. All these are very specific behaviors. And sometimes the child may be laughing inappropriately, crying inappropriately. He will not be having awareness towards the danger. He will be hyperactive sometimes, and he will not allow others to touch and being touched, and he will be having less eye contact, and he will be having attachment to the strange objects. Sometimes he may be clingy to the mother. Sometimes he may be clingy to the father. Attachment. Clinginess means attachment. So these are the typical symptoms you can see. Hand flapping behavior, and also the compulsive behavior, self-injury behavior, and injuring others' children sometimes, and also keeping the objects in a row like vertical or horizontal, blocks and all, and also behavioral problems you can see in some children, like pulling the hair and beating and fighting and all, and repetitive stereotypic motor movements also you can see, hand flipping, rocking back and forth, spinning in a circle all the time, finger flicking, head banging to the floor or to the wall, staring at lights all the time, moving fingers in front of eyes, flicking lights, the switches on and off, and walking on the toes sometimes. So all these, once you identify these children with these problems, immediately you start intervention or therapeutic intervention. That is very important, early intervention. And in India, what is happening? When the parents bring the child to the doctor, generally the doctors are seeing the children, and the psychologists, they are attending the child, and they are assessing, the autism spectrum rating scale, COS test, and ISA scales like that. And after that, they will diagnose with so-and-so borderline or mild autism or moderate autism. Within one day, how can you judge a child with so-and-so autism? No, it's not good. You have to observe the child in number of settings. After some eight sessions, then you will observe, okay, this child is developing ASD symptoms, or this child already developed ASD symptoms, or there is a probability of this child may develop. So this is a provisional diagnosis and differential diagnosis. You cannot judge any child with so-and-so neurodevelopmental disability before the age of 6 years, because before the age of 6 years is a growing stage. The brain is under growth. How can you judge any child with so-and-so neurodevelopmental disability like autism, ADHD and all? But it is happening in India. Actually, you are not supposed to judge any child. Okay, so regression, stagnation, and developmental delay. These three concepts are very, very confusing, and please do not confuse. For example, regression means the child will be normal up to 1.5 or 2 years. Suddenly, there will be a decline there will be a decline of his development, like sensory development, motor development, speech language communication development, or academic development, or intellectual. So this decline is called as regression. The child will be having regression. Stagnation means right from early childhood, right from the beginning, right from the birth, the child's growth and development will be stunted, that is stagnated, that is stagnation. And delay means the child will attain the developmental milestones with delay. Instead of 1 year, the child will walk at the age of 2 years. Instead of 1 year, the child will speak one word at the 2 years. So this is developmental delay. Don't get confused. There are so many, scales are there. Generally the psychologists will use the scales to diagnose the child. And remember, the child will be having so many sensory difficulties, like auditory, visual, tactile, touch, all this behavioral. So hypersensitivity and hyposensitivity, both will be there. So they need sensory, multi-sensory integration therapy. And what we see with our eyes, the child's behavior, you can observe. But you cannot see what is happening inside of the brain of the child. That has to be addressed. That has to be known. That is very important. For example, the child may be behaving, in a hyperactive way, overactive way, distractive way. But why the child is behaving like that? What is happening to his body inside? Inside is important. The brain, maybe he's maybe having seizures. He may be having fits inside of the brain. He may be having the constipation. He may be having some other problems like last night he might have not slept properly. So this is what causing irritability, frustration, and all that you need to observe. Because you see only pushing, spitting, shouting, hitting, throwing, swearing, all these are common behavior. But you cannot see underlying deficits which are causing these specific behaviors. And sometimes the child looks lazy, unmotivated, waits for physical verbal prompts, and over-dependent on the elders. So that is very important. Okay. And there are so many therapies. I don't want to go in detail about the therapies, but medical treatments, which I don't want to go in detail here. But for you, the parents, yes, they feel burden. The parents feel overburdened everyday responsibility of caring the child with autism or ADHD, whoever may be. They feel pressure to become an autism expert and learn everything overnight. And they may worry about the child's and family future. And they may have difficulty in finding the balance with their lives. And because they will be having other children also to take care. And they may be less inclined to share their feelings. They may become stressed about the family finances and unknown of the situation. And they develop some problems sometimes, like maybe distress or anxiety or like that. So it is very important for the parents, which I had to convey is, do not blame yourself. Please seek advice from the doctors when you identify red flags in the child. And also do research, best of research about your child. That means read the child, observe the child behavior in all the situations. Do ensure consistency of approach and be like a co-therapist. If you are sending the therapist to the therapist, and it is very important, you as a parents should be like a co-therapist at home. You also should involve. Without parental involvement in the therapy, no child will improve, I'm sure. So your role is very important. And also don't rearrange your whole life around your child. Do have open discussions with your doctor. And also be patient, stay positive, take responsibility. You are the leader in the multidisciplinary team. You should be like an expert, think critically, speak with authority, and also you should prepare the diary about your child's activities. And I don't want to go in detail here. Many of the parents, they are on the diet of gluten casein-free diet. But I just want to highlight one thing very important here is this gluten casein-free diet, because many parents, their children are the GCF diet. Okay, here one slide is very important. At Oxford University, Dr. S. Radhakrishnan, while speaking, one of his students raised a question. Sir, what is the difference between a station master and a schoolmaster? All were eagerly waiting for his answer because they thought it is an irrelevant question to him. But he coolly replied, the station master minds the train. The schoolmaster trains the mind. See, such a wonderful illustration, differentiation which he has given. So the station master minds the train, schoolmaster trains the mind. It is not you to train your child. It is you need to train the child's brain. That is very important. Okay. And here one very important slide, 400% of increase in the risk of brain cancer among the teenage Indians using smartphones excessively. By IIT professor. He is from electrical engineering department, IIT Mumbai. He did research, he found that there are a lot of mutations happening in our Indian youth adults who are using excessively the phones. The DNA is undergoing mutations. Please be cautious about this. So I want to highlight here one thing, that Indian Academy of Pediatrics, they have given crystal clear guidance about the treatment modalities for the children with autism. This is a very important slide. Many parents are approaching various n number of therapies, but which therapy is very important, which is evidence-based, which is having scientific reason that every parent, even the professionals, should know. So GCF diet, that is gluten and casein-free diet, is not recommended for children with autism. This is very important, clear cut. Many therapy centers, many therapists, even the non-professionals, they are suggesting this GCF diet. Please do not. It is very important. Children need their bones growth, their muscles growth, first of all. If you keep the child on GCF, gluten casein-free diet, the child bones and muscles will not grow. Remember, early osteoporosis, early osteoporosis, and early osteoarthritis the child has to face. And other therapies like intravenous immunoglobulins, vitamin A, vitamin B6, and magnesium, and removal of metals, that is chelation therapy, hyperbaric oxygen therapy, and homeotherapy, and stem cell therapy, plant transplantation, not at all recommended. Not at all recommended. These are the therapies which are non-evidence-based practices which are happening in India. Okay. And nowadays, of course, assistive reproductive technology is increasing in the risk of autism. The parents who are, the young couples who are approaching IVF centers, and also, other like OSD, ovulation stimulation drugs. And nowadays, the surrogacy, the rented, the garbhas, that is surrogacy, it is increasing. A recent study has claimed that fertility treatments like increasing risk of autism in children, preferably in developed and developing nations. So those, we call them as autistic surrogates. Okay. So that's it. Thank you so much. I think I completed because of a number of slides. The important slides which are relevant and appropriate to you people, you professionals, I just presented. In detail, medical depth technology, depth concepts I have not covered, which are not required at this time. Thank you so much. If you have any doubts, you can clear. I'm ready here to clarify your doubts. Thank you so much.
Thank you, sir. Thank you, sir. Really, it's very useful for us who are suffering with autism. Children, so many children are there suffering this with this disability. So, audience, please request to any doubts or any queries, please ask with the sir. Please.
Hello.
Yes,
I have one question, sir.
Yes, please.
Which therapy we can apply on the child who is aged as a psychologist?
Pardon, please.
Which therapy we can apply on the child who is aged as a psychologist?
Are you a psychologist? Okay. See,
As
in
a
the
psychologist, we can apply on aged child.
yeah. Psychologist role is, you see, I'm telling you again, it is not a single man's job dealing the child with autism spectrum disorder. It's a multidisciplinary team approach. There are physiotherapists, speech therapists, occupational therapists, special educators, doctors, psychologists, nutritionists, dietitian, so many, even the parents as the co-therapist at home. And also the community also works like a therapist, okay? So everyone should involve in the therapy of the child. So what are the various therapies? If the child is having speech language communication problems, speech pathology and audiologist role will be there. If the child is having sensory processing difficulty, occupational therapist role is there. If the child is having behavioral issues, psychologist role will be there. If the child is having physical deformities, the physiotherapist role will be there. The child needs inclusive education, special educator role will be there. If the child needs the medical treatment and the diagnosis, the doctor's role will be here. So, and if the child is having some nutritional recommendations, the dietitian role will be there. And the child needs, the community also, the parents also, everything. The psychologist, when it comes to, the psychologist will assess the child on the ISA scale and CORS scale and autism rating scale, and they will find that, okay, this is the child having this severity, like borderline autism spectrum disorder or mild autism spectrum disorder, and also the psychologist has to recommend what therapies are required. So that is the limitation of the role of the psychologist. Okay.
Only assessment, sir?
Assessment and also psychotherapy. If the child is having behavioral problems, it is your duty to, give the psychotherapy. That is called applied behavioral analysis, ABA therapy, behavior modification therapy. If the child is having hyperactive behavior, overactive behavior, distractive behavior, violent behavior, hitting and all, throwing temper tantrums and all, it is your duty to suggest the program to the parents at home to do it. At the same time, you as a psychologist, you have to train the child in the therapy center. I mean, yes, please.
One question, sir, or one question. Is ASD appears in CP child?
CP,
Okay.
cerebral palsy.
Is ASD?
Cerebral palsy.
Yeah, but I'm not getting, sorry.
తెలుగులో కూడా అడగొచ్చు సార్ ని, నో ప్రాబ్లం.
చెప్పండి
తెలుగులో కూడా చెప్తారు. మీరు ఒకవేళ ఇబ్బంది పడుతుంటే తెలుగులో కూడా అడగొచ్చు అందరు, ఎవరైనా సరే.
చెప్పండి మేడం.
ASD appears in CP child?
Yeah, autism spectrum disorder is combination in cerebral palsy, learning disabilities, intellectual disability. ఇక్కడ ఒకటి బాగా గుర్తుపెట్టుకోండి, చాలా మంది కన్ఫ్యూజన్ అయ్యేది ఇక్కడే. ఇక్కడ న్యూరో డెవలప్మెంటల్ డిజబిలిటీస్ చాలా ఉన్నాయి. ఫస్ట్ పాయింట్, ఇంటెలెక్చువల్ డిసబిలిటీ, ఆటిజం స్పెక్ట్రమ్ డిజార్డర్, విజువల్ ఇంపైర్మెంట్, హియరింగ్ ఇంపైర్మెంట్, అండ్ అటెన్షన్ డెఫిసిట్ హైపర్ యాక్టివ్ డిజార్డర్, అండ్ అటెన్షన్ డెఫిసిట్ డిజార్డర్, ADD, cerebral palsy, so many are there. ఇంటెలెక్చువల్ డిజబిలిటీకి ఆటిజం స్పెక్ట్రమ్ డిజార్డర్ కి రెండు వేరు. బోత్ ఆర్ డిఫరెంట్. డోంట్ మర్జ్, డోంట్ గెట్ దెమ్ టుగెదర్. బోత్ ఆర్ డిఫరెంట్ యాజ్ పర్ DSM 5th criteria. ఇక్కడ ఇష్యూ ఏంటంటే, సమ్ టైమ్స్ in one child 3 or 4 disabilities he may face, either intellectual disability, autism spectrum disorder, even cerebral palsy also. So even visual impairment also, hearing impairment also.
Hello.
Combination of the neurodevelopmental disabilities in one child you can see, but very less in number. But predominantly you can see it is also there, 1 or 2%. Did you got clarity, Jayanti madam? Yes.
Yes, sir.
Yeah. Yes, please. Any doubts?
Is it
Cheppandi, maatladandi.
curable? I mean, in how many days it takes for it will be completely cured, or it will be lifelong?
There is no magical cure for children with autism spectrum disorder. Only thing is the therapy is the mainstay. Pharmacotherapy ante medicines eppudayya ichchedante, పిల్లవాడికి ఫిట్స్ ఉన్నప్పుడు కంపల్సరీగా ఫిట్స్ కి మందులు ఇవ్వాలి. పిల్లవాడికి హైపర్ యాక్టివ్ ఉంటే హైపర్ యాక్టివ్ మెడిసిన్స్ పెడతాము. పిల్లవాడికి కనుక స్టమక్ ప్రాబ్లమ్స్ ఏమైనా అప్సెట్ ఉంటే లాక్సేటివ్స్ పెడతాం. డైజెషన్ ప్రాబ్లం ఉంటే, కాన్స్టిపేషన్ ఉంటే, పిల్లవాడికి ఇన్సోమ్నియా అంటే స్లీపింగ్ సిక్నెస్ ఉంటే వాడికి మెలటోనిన్ సిరప్. ఇట్లా డిఫరెంట్, అంటే మందులు అవసరమైతేనే ఫార్మకోథెరపీ ఉంటుంది. ఫార్మకోథెరపీతో పిల్లడికి సెట్ కాడు, ఓన్లీ థెరపీయే. అది కూడా ఏంటి, ఆల్ పీపుల్ షుడ్ ఇన్వాల్వ్. అందుకే దాన్ని ఇంటిగ్రేషన్ అంటారు, అందుకే దాన్ని ఇన్క్లూజివ్ ఎడ్యుకేషన్ అంటారు. అసలు ఇన్క్లూజివ్ ఎడ్యుకేషన్ అంటే ఫస్ట్ ఇంట్లో ఫ్యామిలీ ఇంక్లూజివ్ ఉండాలి. ఈ పిల్లవాడిని ఫస్ట్ ఫ్యామిలీ వాళ్ళు యాక్సెప్ట్ చేయాలి. అంటే మదర్ సైడ్, ఫాదర్ సైడ్, చుట్టాలు, అందరు బంధువులు, చుట్టుపక్కల నైబర్స్ అందరు సపోర్టివ్ గా ఉంటేనే ఈ పిల్లవాడు ఇంప్రూవ్ అవుతాడు. ఫ్యామిలీ ఇంక్లూజన్, కమ్యూనిటీ ఇంక్లూజన్, సోషల్ ఇంక్లూజన్, దెన్ స్కూల్ ఎడ్యుకేషన్ ఇంక్లూజన్, అప్పుడు ఫైనల్ గా. కానీ ఫ్యామిలీ ఇంక్లూజన్ కాకుండా, నైబర్హుడ్ ఇంక్లూజన్ కాకుండా, సోషల్ ఇంక్లూజన్ కాకుండా వాడు స్కూల్లో ఇంక్లూజన్ కాలేడు. యూ కెనాట్. సో యూ హ్యావ్ టు ఫోకస్ ఆన్ ఇంక్లూజివ్. అందుకే నేషనల్ ఎడ్యుకేషన్ పాలసీలో NEP గైడ్లైన్స్ వెరీ క్లియర్లీ స్టేటింగ్ దట్ ద చైల్డ్ షుడ్ బి ఇంక్లూడెడ్ ఇన్ ఆల్ సెట్టింగ్స్, ఇన్ ఆల్ సెటప్స్. దట్స్ వెరీ ఇంపార్టెంట్. That is called nothing but acceptance.
Language issues, Emanna, like we talk different language at home, and బయట వేరే లాంగ్వేజ్. సో ఈస్ దేర్ ఎనీ అంటే వాళ్ళకి ఏమైనా ఇష్యూస్ అవుతాయా? లైక్
బైలింగ్వేజ్
అండర్స్టాండింగ్.
ఇప్పుడు ఈ రోజులు ఏం జరుగుతుందంటే ఫ్యామిలీస్ లో మదర్ ఒక లాంగ్వేజ్ మాట్లాడుతుంది, ఫాదర్ ఒక లాంగ్వేజ్ ఇంపోజ్ చేస్తున్నాడు, గ్రాండ్ పేరెంట్స్ ఒక లాంగ్వేజ్ ఉంది. ఒకప్పుడు మోనో లింగ్విస్ట్ ఉండి తర్వాత బైలింగ్విస్టిక్ అయింది, ఇప్పుడు ట్రైలింగ్విస్టిక్ అయింది, మల్టీ లింగ్విస్టిక్ లాంగ్వేజ్ కి చైల్డ్ ఎక్స్పోజ్ అవుతున్నాడు. కానీ న్యూరాలజీ రిసర్చ్ ఏం చెప్తుందంటే బైలింగ్విస్టిక్ చిల్డ్రన్ ఆర్ ఇంటెలిజెంట్స్ దాన్ ద మోనో లింగ్విస్టిక్. ఇది రిసర్చ్ క్లియర్ చెప్తుంది. అంటే రెండు భాషలు మాట్లాడేటువంటి పిల్లవాడికి తెలివితేటలు ఎక్కువ ఉంటాయి అనేది ఒక రిసర్చ్ క్లియర్ గా ఉంది. ఎందుకంటే ద బ్రెయిన్ హ్యాస్ టు లెర్న్ ఎవ్రీథింగ్. సో న్యాచురల్ ఎక్స్పోజర్ ఎక్కువ ఉంటుంది, ఎర్లీ ఎక్స్పోజర్.
ఓకే.
హలో
Yes.
గుడ్ ఆఫ్టర్నూన్ సార్.
చెప్పండి. గుడ్ ఆఫ్టర్నూన్.
హలో
ఎస్ ప్లీజ్.
సార్, మా బాబు చాలా హైపర్ ఉన్నాడు. ఆయనకి అలోపతిక్ మెడిసిన్స్ యూజ్ చేయొచ్చా సార్? లైక్ రెస్పిరేటరీ.
ఇక్కడ ఒక విషయం చెప్పాలండి, హైపర్ యాక్టివ్ బిహేవియర్ కి ఓవర్ యాక్టివ్ బిహేవియర్ కి బేసికల్లీ డైరెక్ట్లీ వీ విల్ నాట్ రికమెండ్ ఎనీ కైండ్ ఆఫ్ మెడికేషన్. ఎందుకంటే మెడికేషన్ అనేది డైరెక్ట్ గా ఎవరు ఇవ్వరు. ఫస్ట్ పిల్లవాడిని న్యాచురల్ గా హైపర్ యాక్టివిటీని తగ్గించేటటువంటి విధానాలని ప్రక్రియలను వెతుకుతాం. ఏంటి వాడిని సింపుల్ గా ఓవర్ ఫిజికల్ యాక్టివిటీలో పెట్టడం. అంటే రోజు ఆటలు ఆడించటం, గ్రౌండ్ తీసుకెళ్లటం, సాయంత్రం పూట పగలు గంట బాగా ఆడమని చెప్పటం పియర్ గ్రూప్ తో, కన్స్ట్రక్టివ్ అవుట్డోర్ గేమ్స్. సెకండ్ వచ్చేసరికి టైం టు టైం బ్రేక్ఫాస్ట్, లంచ్, డిన్నర్. ప్లస్ డైట్ లో కూడా గోధుమలు అంటే ఎక్కువ వీటికి సంబంధించినవి, మైదాకు సంబంధించినవి, షుగర్స్, స్వీట్స్, ఐస్ క్రీమ్స్, చాక్లెట్స్, జంక్ ఫుడ్, సీల్డ్ ఫుడ్, ప్యాక్డ్ ఫుడ్, ఇన్స్టాంట్ ఫుడ్, ఇవన్నీ ఎనర్జీ ఇచ్చేటటువంటి. సో ఇవి కనుక పేరెంట్స్ కనుక ఇస్తుందంటే వాటిని మాక్సిమం తగ్గించమని చెప్తాం. స్వగృహ ఫుడ్స్ అంటే హోమ్ మేడ్ ఫుడ్స్ ఇవ్వమని చెప్తాం. సో ఈ ఐటమ్స్ తగ్గించడం వల్ల వాడిలో ఎనర్జీ లెవెల్స్ తగ్గిపోతాయి. వాళ్ళు ఎనర్జీ లెవెల్స్ తగ్గుతాయి కాబట్టి ఒక చోట స్థిరంగా ఉంటాడు. వాడిని గ్రౌండ్ తీసుకెళ్ళాలి. ఈ ఫుడ్ ఐటమ్స్ లో కూడా మంచిగా బ్యాలెన్స్డ్ డైట్ కనుక చేస్తే ఆటోమేటిక్ గా వాళ్ళ హైపర్ యాక్టివిటీ తగ్గుతాయి. ఇవేమి చేయకుండా పిల్లవాడు మరి ఇంట్లోనే పెడితే పంజరంలో చిలకలాగా వాడు ఏం చేస్తాడు, హైపర్ యాక్టివ్. ఇంట్లో వాడు డిస్టర్బ్ అవుతాడు, ఫ్యామిలీ మెంబర్స్ డిస్టర్బ్ చేస్తాడు, ఇవన్నీ జరుగుతాయి. దీనికి మందులు అవసరమా? లేవు. ఒకవేళ ఇవన్నీ చేసిన తర్వాత కూడా పిల్లవాడు హైపర్ గా ఉన్నాడు అని అంటే దెన్ వి విల్ గో ఫర్ ఈజీ టెస్ట్, ఎలక్ట్రోఎన్సెఫలోగ్రామ్, ఈఈజీ. ఆ టెస్ట్ చేసి రిపోర్ట్ లో కనుక ప్రాబ్లం వస్తే అప్పుడు మెడిసిన్స్ పెడతాం. అది కూడా పిల్లవాడికి లో డోస్ లో స్టార్ట్ చేసి స్లోగా గ్రాడ్యువల్ గా తగ్గించేస్తాం, స్టాప్ చేస్తాం.
హలో,
ఇది కూడా ఎప్పుడు 5 years 6 years అబోవ్ చిల్డ్రన్స్ కి మాత్రమే, నాట్ బిలో ద 6 years ఆఫ్ ఏజ్. ఎస్ ప్లీజ్.
సార్ గుడ్ మార్నింగ్ సార్.
హలో
సార్ గుడ్ మార్నింగ్ సార్. హలో
స్పీక్.
హలో సార్. హలో
మాట్లాడండి, ఎవరో ఒకరు. Go ahead.
హలో సార్, గుడ్ మార్నింగ్ సార్. హలో,
I am listening. Yes, you are audible. Tell me.
హలో
చెప్పండి, వినిపిస్తుంది, చెప్పండి.
సార్, మా బాబు చాలా హైపర్ గా ఉన్నాడు. హలో, వినిపిస్తుందా మేడం?
ఏజ్ ఎంత?
సార్ 7 years సార్.
ఓకే.
చాలా హైపర్ ఉంటాడు. ఆల్రెడీ మేము స్పీచ్ థెరపీ ఇప్పించాము. అంతకుముందు రిపిటేషన్ బిహేవియర్ ఉండే, అది తగ్గింది, కానీ హైపర్ తగ్గట్లేదు సార్.
ఈజీ టెస్ట్ చేయించారా?
లేదు సార్, లేదు.
ఈజీ టెస్ట్ చేయించండి. ఈజీ విత్ సెడేషన్. ఈజీ విత్ సెడేషన్ అంటే నిద్రపోతున్నప్పుడు ఈజీ టెస్ట్ చేయించి ఆ రిపోర్ట్ చూస్తే ఏ డాక్టర్ కలిసినా కానీ మందులు అవసరం లేదు చెప్పేస్తారు.
అయితే ఫస్ట్ ఆటిజం ఉందని చెప్పారు సార్. మళ్ళీ NHMs కి వెళ్ళాము, మళ్ళీ రిపోర్ట్ నార్మల్ గానే ఇచ్చారు, కానీ హైపర్ తగ్గట్లేదు, హ్యాండ్ రైటింగ్ ఇంప్రూవ్ కావట్లేదు సార్. ఒక్కతోన సీమితంగా ఉంటాడు అసలు.
నేను అదే చెప్తున్నానండి, ఒక్కసారి మీరు ఈఈజీ టెస్ట్, నాట్ ఈసీజీ. ఈసీజీ అనేది హార్ట్ కి, ఈజీ అంటే బ్రెయిన్ కి. ఎలక్ట్రోఎన్సెఫలోగ్రామ్, ఈఈజీ. ఈజీలో 2 రకాలు ఉంటాయి, విత్ సెడేషన్, వితౌట్ సెడేషన్. సో విత్ సెడేషన్ వద్దు, వితౌట్ సెడేషన్. స్లీప్ ఈజీ అండి, స్లీప్ ఈజీ టెస్ట్ చేయించండి. ఆ రిపోర్ట్ ఏ డాక్టర్ చూపించినా ప్రాబ్లం ఉంటే మెడిసిన్స్ రాస్తారు. రెస్పిరేటరీ చాలా ఉన్నాయి, మందులు అవి పెట్టేస్తే సెట్ అయిపోతుంది.
అయితే NHMs లో మెడిసిన్ ఇచ్చారు సార్, మేము మధ్యలో ఆఫ్ చేశాము. అప్పుడు బాగానే ఉండే, ఒక దగ్గర ఉంటుండే, కానీ ఇప్పుడు ఉండట్లేదు సార్. ఆ మెడిసిన్ ఆఫ్ చేసినందుకు ఇట్లా అది ప్రాబ్లం ఉంది.
ఇండియాలో దౌర్భాగ్యం ఏంటంటే ఫాలో అప్ సరిగ్గా ఉండదు. ఏదో మందులు రాస్తే ఆ మందులు పూర్తిగా మారరు, పూర్తి కోర్సు వాడరు. ఒక పతి నుంచి ఇంకొక పతికి పోతారు, అల్లోపతి నుంచి హోమియోపతికి పోతారు, హోమియోపతి నుంచి న్యాచురోపతికి పోతారు, న్యాచురోపతి నుంచి ఆయుర్వేదం పోతారు, ఇట్లా తిరుగుతా ఉంటారు. పక్కోళ్ళు వాడు చెప్తారు, ఇంకో మాట వెళ్ళిపోతుంటారు. ఒక చోట స్టిక్ గా ఉండరు. ఇక్కడ డాక్టర్స్ షాపింగ్, థెరపీ సెంటర్ల షాపింగ్, థెరపీల షాపింగ్ అన్ని అయిపోయిన తర్వాత పిల్లవాడి బ్రెయిన్ డెవలప్ అయ్యి వాడికి డిపెండెంట్ అయ్యి వాడిని ఒక చోట బర్డెన్ గా తయారైపోయి అప్పుడు కూర్చుంటారు. ఇది జరుగుతున్నటువంటి నిజం.
సార్ నమస్కారం సార్.
ఎగ్జాక్ట్లీ సార్.
చెప్పండి
సార్ నమస్కారం సార్.
చెప్పండి పీటర్ గారు చెప్పండి.
సార్ ఆటిజం ADHD రెండు కూడా ఈ పర్టికులర్ ఏజ్ లో వచ్చి ఎప్పటి వరకు ఉంటుంది సార్ ఇది?
నేను అదే చెప్పానండి, ఇది డిపెండ్స్. తొందరగా ఎర్లీగా ఐడెంటిఫై చేసి ఎర్లీ ఇంటర్వెన్షన్ తొందరగా ఇస్తే సెట్ అయిపోతుంది. ఇక్కడ ఇంకొక విషయం బాగా చెప్పాలి మీకు. బోర్డర్ లైన్, మైల్డ్ ఆటిజం స్పెక్ట్రమ్ డిజార్డర్, ఇంటెలెక్చువల్ డిజబిలిటీ, ADHD ఏదైనా కానీ బోర్డర్ లైన్, మైల్డ్ వీళ్ళని నార్మల్ స్కూల్లో ఇంటిగ్రేట్ చేయొచ్చు విత్ స్పెషల్ రిసోర్సెస్. నార్మల్ స్కూళ్ళలో ఇన్క్లూజివ్ ఎడ్యుకేషన్ కి నార్మల్ స్కూళ్ళలో ఇలా పంపించవచ్చు. ఎవరెవరు? బోర్డర్ లైన్, మైల్డ్. ఈ మోడరేట్ వాళ్ళు సివియర్ వాళ్ళు, మోడరేట్ సివియర్ ఆటిజం స్పెక్ట్రమ్ డిజార్డర్, మోడరేట్ సివియర్ ADHD, మోడరన్ సివియర్ ప్రాబ్లం ఉన్నటువంటి డిజబిలిటీస్ కి ఫార్మోకోథెరపీ అంటే మెడిసిన్స్ కూడా అవసరము, ప్లస్ స్పెషల్ సెట్టింగ్స్ అవసరము. అది మోడరేట్ సివియర్. ప్రొఫౌండ్ అంటే ఇక టోటల్ కస్టోడియల్ వాళ్ళ ఇంట్లో ఉండాల్సి వస్తుంది. అయితే నేషనల్ ఎడ్యుకేషన్ పాలసీ క్లియర్ గా ఏముందంటే మాక్సిమం ఈ న్యూరో డెవలప్మెంటల్ డిజబిలిటీ పిల్లల్ని నార్మల్ స్కూళ్లలో నార్మల్ ఎడ్యుకేషన్ ఇంటిగ్రేట్ చేయాలి అని రాసింది విత్ అడిషనల్ సపోర్ట్. అది స్పెషల్ ఎడ్యుకేటర్స్ కావచ్చు, థెరపిస్టులు కూడా స్కూల్కి వెళ్ళి సర్వీస్ ఇవ్వటం కావచ్చు, ఇన్క్లూజివ్ ఎడ్యుకేషన్, ఇన్క్లూజివ్ సోషల్ ఇంక్లూజన్, కమ్యూనిటీ ఇంక్లూజన్, ఫ్యామిలీ ఇంక్లూజన్ అన్ని క్లియర్ గా ఎక్స్ప్లెయిన్ చేశారు వాళ్ళు. కాకపోతే అది జరగట్లేదని ప్రాక్టికల్ గ్రౌండ్ వర్క్ లో గ్రౌండ్ రియాలిటీ ఏంటంటే జరగట్లేదు. జరగాల్సినటువంటి బాధ్యత, జరిగేటట్టు చేయాల్సిన బాధ్యత పేరెంట్స్ ది, టీచర్స్ ది, సొసైటల్ మెంబర్స్ ది, థెరపిస్టులది, డాక్టర్లది అందరు కలిపితేనే ఈ పిల్లలు రాణించగలుగుతారు. ఈ పిల్లలలో సప్రెస్డ్ టాలెంట్స్ ఉంటాయి, కానీ అవి బయటికి తీసుకురావటమే మన యొక్క నాలెడ్జ్, మన యొక్క అవేర్నెస్. ఒక వైట్ పేపర్ మీద ఒక వైట్ పేపర్ ని పిల్లవాడిగా మీకు కానీ ఎవరికైనా చూపిస్తే అది వైట్ పేపరే అంటారు. అదే వైట్ పేపర్ మీద ఒక చిన్న రెడ్ కలర్ డాట్ పెట్టండి, మీ ఫోకస్ ఆ రెడ్ కలర్ డాట్ మీద పోతుంది కానీ వైట్ మీద పోదు. ఆ రెడ్ కలర్ డాట్ అనేది డిజబిలిటీ ఆర్ డిజార్డర్ ఆర్ డిఫికల్టీ. కానీ వైట్ బ్యాక్గ్రౌండ్ చాలా పెద్దది. ఆ వైట్ బ్యాక్గ్రౌండ్ ఏదైతే ఉందో అది పిల్లవాడి యొక్క ఎబిలిటీస్, పిల్లవాడి యొక్క స్కిల్స్, పిల్లవాడి యొక్క స్ట్రెంగ్స్, వాటిని పట్టించుకోకుండా వైట్ని మన ఫోకస్ అంతా ఆ చిన్న సైజు రెడ్ డాట్ మీద పోతుంది. మనం అక్కడే టైం వేస్ట్ చేస్తాము. అలా కాకుండా వాడి ఎబిలిటీస్ మీద కనుక మనం టైం కనుక ఫోకస్ చేస్తే, మన ఎనర్జీ ఫోకస్ చేస్తే ఆటోమేటిక్ గా రెడ్ డాట్ కూడా ఆ ప్రవాహంలో కొట్టుకుపోతుంది. కానీ మనం అలా చేయట్లేదు.
థ్యాంక్ యూ సార్. ఇది ఒక టాపిక్ సార్, మన సైకాలజీ సబ్జెక్ట్ లో లర్నింగ్ డిజబిలిటీ ఒక టాపిక్ ఉంది సార్, చాలా బాగా ఎక్స్ప్లెయిన్ చేస్తారు సార్. చాలా థ్యాంక్ యూ సార్.
ఓకే, థ్యాంక్ యూ సో మచ్ సార్. రియల్లీ వెరీ.
Yes, good afternoon, sir.
Hello. చెప్పండి.
I would like to invite
మల్లేష్ గారు అడుగుతున్నారు, చెప్పండి.
Yes, sir. Good afternoon, sir. Thank you very much for your wonderful slide presentation, sir. I'm very thankful to BRU Institute. I'm the special educator, sir. I'm working in the private institute. So, being a with your session, thank you so much, sir. If it is possible, every month, can you conduct one program about
your voice is breaking,
disabilities like autism spectrum disorder?
Your voice is breaking, sir.
Intellectual disability.
Thank you so much, sir, and everybody. I would like to invite Dr. J. Arunaji. Please say a vote of thanks.
Good afternoon, everyone. It is my privilege to propose the vote of thanks on behalf of the Faculty of Education, Dr. B.R. Ambedkar Open University, on the occasion of World Disability Day, for today's insightful webinar on the topic Evidence-Based Concepts and Facts, Autism Spectrum Disorder. First and foremost, I extend my heartfelt gratitude to our esteemed resource person, Dr. Jagdish Garu, Senior Consultant at Apollo Hospitals. Your enlightening presentation on autism spectrum disorder, grounded in evidence-based knowledge, has provided us with invaluable insights, sir. Your expertise and dedication to this critical field have inspired us all to deepen our understanding and commitment to supporting individuals with autism spectrum. I also take this opportunity to thank our Vice Chancellor, sir, and Registrar Madam A. Sudharani Garu, and Webinar Director, Professor Chandrakala Garu, for her visionary leadership and unwavering support in making this event a reality. Your meticulous planning and guidance have been instrumental in its success, madam. And a special thanks to our co-director, Professor Mary Sunanda Garu, for her dynamic coordination and continuous efforts to ensure the smooth execution of this webinar. Your enthusiasm and dedication have been truly commendable, madam. I would especially thank our beloved Director Academic, Professor Pushpa Chakrapani Garu, for her unwavering support and confidence in us. I extend my appreciation to all the participants, including faculty members, students, and other attendees who have joined online, for your active engagement and thought-provoking questions. Your participation has enriched the discussions and made this event more interactive and meaningful. Lastly, I express my gratitude to the technical team and supporting staff for their behind-the-scenes efforts in ensuring that the webinar ran seamlessly. Thank you, one and all. Thank you.
Thank you. Thank you, sir. Thank you so much.
Thank you, ma'am. Thank you so much for giving me this
Thank you all.
opportunity to interact with all of you. Thank you so much. Have a great day. Thank you. God bless you on this on this International Disability Day. It's a wonderful opportunity for me to interact with all of you. Thank you so much. Thank you.